The goal here at Post-Acute Medical is to address the acute as well as chronic illnesses in our patients. We try our best to get our patients home with their families. We do everything we can to achieve that goal. The nursing staff here, everybody involved in the care of the patients, physical therapists, respiratory therapists, we strive to do the best we can to take care of our patients just like they're our family members. Richard Morrison. I'm one of the pulmonary critical care physicians here at Post-Acute Medical. I'm also the medical director of respiratory therapy. We specialize in taking care of ventilator patients. A lot of those patients have chronic respiratory diseases, COPD. We see a lot of patients with acute illness as well, like a pneumonia. Those patients could very well need ventilator support, and we have the disease-specific program that addresses all of those issues in all of those patients.
My name is Allie Chandler, and I'm the Director of Respiratory Therapy here for Post-Acute Medical Hospitals in Shreveport. A lot of times we receive patients that are very sick on ventilators or that have tracheostomies that need further care. Our job here is to progress them to a level in which they can return home. That might be that we are totally able to eliminate their vent use or able to remove their trach so that they can go home just on room air or at a lower level of oxygen so that they can take care of themselves better. We provide breathing treatments, ventilator care, oral care. We are what you call a pulmonary center of excellence. It's Joint Commission certified, and we pride ourselves on being able to provide excellent pulmonary care at the bedside and home education so that when people leave us, they have the best chance of not being readmitted to the facility that they came from.
My name is Michael Berry, and my mom is a patient at Post-Acute Medical. She came here and she's been here for 4 weeks now, and it's been a wonderful experience, not only for her because she's getting the acute medical attention she needs, but she's also getting the rehab she needs. I like to look at Post-Acute Medical as kind of a bridge, and our ultimate goal is, of course, is to get my mother home, but she was not ready to go home from a hospital. PAM has been that bridge for her and for me for the last 4 weeks. It's been wonderful.
My name is Pierre Blanchard. I am the medical director for PAM for both hospitals here in Shreveport and a practicing physician for 45 years. Well, I think the patient and the families can expect aggressive medical care with appropriate subspecialty help to assist the primary care physicians like myself have a more intensive regimen for a longer period, whether it's our wound care as well as respiratory therapy. Those would be the primary areas where we have focused. Our employees are very motivated, they're very kind, which is what these people and their families need. They're directed in all areas, including therapy, which we like to get them up as quickly and as rapidly as we can.
One of the most gratifying things that we see is when a patient walks back in our building. We've had patients with traumatic brain injuries that the odds of them ever being able to walk and take care of themselves were against them, but I've seen those patients walk back in our building and hug our necks, and that's one of the best feelings you can ever get.